Dr. Declan Fleming joins us now. Thank you so much for being here today. We want to learn a little bit more about pancreatic cancer. What are some of the symptoms? I often hear that people don't find out about this cancer until it's too late. What can people be looking for?
Well, that's a great question. Because the pancreas is so deep inside the abdomen, we don't have the nerves going to it the same that we would on our hands or anything else like that. So the symptoms are pretty vague at first. Most people will have a little bit of abdominal discomfort in the upper abdomen, sometimes some nausea. A couple things that people experience as it begins to progress is a lot of people will end up losing weight. It's frequent now that people that develop pancreas cancer become diabetic. So if you find an adult that's not been diabetic all his or her life, and later in life they become diabetic associated with weight loss and some abdominal discomfort, that's kind of the big triad of things to be worried about.
How common is pancreatic cancer?
Well, fortunately, it's not very common. Unfortunately, for people that get it, it really can be very devastating. Again, because it's found so late, its prognosis is oftentimes very bad. Over 85% of people in the United States that are diagnosed with pancreatic cancer will have a more advanced stage disease.
And I understand that there aren't a whole lot of treatment options. Can you talk to us about what there is out there?
Well, sure. Our treatment options are definitely better today than they have been for a long time. Essentially, anyone who has a pancreas cancer will do best if they can get all three of the main treatment modalities, and that is chemotherapy, because there's a risk of spread of cancer anywhere in the body. The only treatment that delivers treatment everywhere in the body simultaneously is chemotherapy. Radiation therapy helps to give treatment to the tissues nearby the pancreas, and then surgery to be able to remove the tumor itself and the lymph nodes nearby. People that can get all three of those have the absolute best prognosis of everyone else. It's just that you've got to find the person that is right to receive those treatments.
Real quick, what are the odds of survival with this cancer?
Well, it varies according to stage. If we're fortunate enough to find a person who has a stage 1 cancer, that's a small tumor only located in the place where it began, those people actually have a pretty good chance of survival, and probably 40 to 60% at around 5 years. Stage 2, a larger tumor, it gets a little worse. 3 and 4 are when the tumor begins to spread to other parts of the body. And the survival rate at 5 years for a person with a stage 4 pancreas cancer is only 3%. So it's really quite low.
We are all thinking of Alex Trebek and wishing him well. And luckily, this is bringing a lot of awareness to pancreatic cancer. And hopefully people are listening to this message and taking a look at those symptoms.
I think that anyone who is beginning to have these symptoms and there's something that persists, and especially it's associated with weight loss, that's really something that we want to see people paying attention to and asking the question beyond, boy, I wonder what's going on. Digging a little deeper, that's when we find this sort of thing and can treat it and cure it.
Great tips. Dr. Fleming, thank you so much for being here today.
Thank you.